Okay, all those in favor?
Aye.
Any opposed? Okay, consent agenda. Does anybody want to pull anything out of the consent agenda?
Do you have anything for the consent agenda now?
Okay. So then I'm looking for a motion to approve the consent agenda.
So moved. Second.
Moved by Abby, seconded by Mindy to approve the consent agenda. Any further discussion? All those in favor?
Aye.
Any opposed? Motion passes. Cole, are you giving the report on it? Why don't we go to the quality committee while you're working on your,
No, I can do it.
okay. Report from the finance committee.
Yeah, so we met as a finance committee here on the 22nd. Basically went through the August financials. One of the very positive highlights I thought was that we had really strong cash collection in the month of August to the tune of $9+ million of cash that was actually collected during the month, which is huge. I don't think it's been that high ever, right?
No.
So, yeah, so yeah, as I say, that was really is a big highlight there. Short-term working capital, no.
Hey, Cole. Got news.
As of last night, we were 10 point,
For the month of
for the month of October, we were 10 points. September, sorry.
There you go. So
On the
I
right.
stand to be corrected, or stand to correct me. So that's awesome. So a lot of good things going on the collection side of things, which is great to see. And we talked about during the meeting, there's been a tremendous amount of improvement in that area. And we're to the point where they're actually working on ramping down some of the outside help, outside resources. And I believe 2 of the 3 firms that are outside resources have actually, but are they completely out now, or is?
In the next 10 days, it'll be all done.
Okay, so ramping down to where they're going to be out, so we'll reduce our outside resources there. The short-term working capital loan was paid down to 1.9 by the end of August. It was at 1.6 at our meeting date. And I'm assuming it's smaller at this point in time. And then I'll come back to that in just a second. 44, and then we were about 44 days cash on hand. It was a strong month as far as operations wise, which a number of things that were mentioned that contributed to that was a significant increase in the swing bed days, an increase in physician clinic visit and labor management on the expense side. But to the tune, we had a net, or I guess we'll go off EBITDA of just under $1 million for the month. So great to see that. The other thing I want to jump back on was Scott and Dan did provide, I'm not sure who else was involved, Scott primarily, I assume, provided a cash flow forecast. It was great to see kind of forecasting cash out over the next 3 months. And that does forecast days cash on hand would be bottoming out basically in the end of September. So basically right as we're speaking now, and then it'll slowly improve from here throughout the year end. The working capital note, short-term working capital note, is obviously it's still being reduced significantly. It is scheduled. Our payoff of that has slowed a bit because of some of the changes with where some of the payments being remitted and through, but it's still scheduled to be fully paid off by the end of the year, right, Scott? Right close there. So it'll be real close at that point. So we'll still see some slight improvement with days cash on hand from here to the end of the year is what's forecasted, with a continued reduction in working capital note And so that's a very positive thing for the organization. With that, I mean, we talked about a number of other things. Got a quick update from Mike on the construction of the Alpine Kemp heliport, and I believe they should have been started by the end of the week. And so I assume that's happened since.
The asphalt is being put down today.
Okay, perfect.
Yes, thanks.
And then the Alpine X-ray remodel should be done by the end of October. So again, just last thing, just reiterate the tremendous improvement in collections and billing. And so I'd like to thank everybody in that department for their hard work. With that, I'm happy to answer any questions or anything I can. Finance committee.
So that short-term note's gonna last through the end of the year. I was thinking we had forecasted about now it'd be paid out.
We were, but if you want me to elaborate on it, I can real quickly.
Not that much. Is it done at the end of the year? I noticed on that cash flow, it went at least clear through December 26th.
It kind of depends on the amount of remittances that go through the bank, right? And we had some challenges because we were required to change the bank to which the remittances went to, and our two biggest payers could not accept the routing number to the new bank, and we're still working that out. But Medicare and Blue Cross made us they couldn't get it to work, so we said, well, then just go directly to First Bank and don't pass go, right? Therefore, our remittances going through there are lower, therefore the principal being paid off is lower. And Optum
Does
has
that
not,
affect our interest rate
there is no
overall?
interest rate other than a one-time fee, so it actually proves the implicit interest rate significantly.
Okay.
So
So the longer we take to pay, the better interest rate it is?
you're taking one amount and spreading it over a longer period.
Right, so you
No,
have
there's no
to
interest.
still
It's fixed
paying.
interest.
Upfront fee.
I understand, then that's still interest.
We're trying to just work with Optum, but we're not kicking the bear, so to speak. They haven't raised any issues, huh?
Is Optum okay with that?
They have not raised any issues. They're still taking 20% of those remittances that are going through, which is fine. So
Okay, any other,
I would like to
Questions
know,
on that?
because you were talking about the asphalt, can you give us an update on like what that's kind of a temporary, asphalt, is it really temporary or is it like a tester? Like, can we get a little background on that? Is there a place in the agenda that would be better suited for?
oh, Mike, you wanna say anything?
Regarding the,
Asphalt?
Temporary, yeah, temporary, but.
Is it, how temporary is
Yeah.
temporary?
Yeah.
according to the FAA, Mike Hunsaker, Vice President of Business Development, I have that for the record. According to the FAA board members, we are allowed to have temporary helipad for a 12-month period. There are some gray areas around that. Since this is a private helipad and not to be used by the public in any way, shape, or form, we may have some wiggle room on the time frame that we have for converting to a permanent site. Now, I'd like the board to know that we are actually applying for some grant funds that would help us pay for a permanent site. And that grant was due today, and one of our staff members has been working hard on getting that grant application ready. So more to come on that. If we were able to obtain grant funds, we certainly would be interested in having a more permanent site with heated concrete and that kind of thing for safety reasons. But I think right now, for the time being, and that could turn into years if the gray area is as such that since it's a temporary helistop, a private helistop, we may not have to meet all the regulations the FAA requires.
So is it been built where we would put a heliport?
It's very close where we would put the permanent one, which will serve us well for a long time if we need to. So.
And so the asphalt, we're not really moving locations. I thought maybe we were just asphalt what might become a parking area. for our
That's
temporary.
correct, yes. Where we're asphalting now for the temporary site will become a parking lot in the future.
Okay. So the asphalt isn't necessarily as temporary as the public work
Correct.
location.
Yes.
Okay.
Good update.
Thank you.
Anything else on finance committee? Any questions for Cole or other members?
Thank you.
Then, Abby,
I'm
report on the
super
quality.
happy to-
Oop.
Were you maybe trying to get Dr. Cowan?
Oh,
back
that's
in?
true. Dr. Cowan, can you hear us?
I sure can.
Oh, we can hear you also.
All right. Well,
Great.
that's good. Sorry, I was just talking away earlier. So, anyway, I apologize for not being there in person. And I know Dr. Cottom's probably left, but I certainly wanted to recognize her as well. It's well deserved, and she makes us better. So, briefly, you can see from the document we continue to grow as a medical staff, but I wanted to address two things in particular during this meeting. Number one, I'm thrilled and excited for Dr. McClure's pain management team to be adding an advanced practice provider. I don't think there's a team more deserving in the system than Dr. McClure's team. And I'm going to go so far as to put everyone on notice that this is going to open the floodgates to the point where we're going to need another APP soon for him. And that's a good thing. So excited for that. Number two, I wanted to give the board a report on medical students. We've gone through two sets of two. And I've been asked many times over the last several months, and question is, why would you do this? And it's been asked multiple times, why would you, quote, subject everyone, unquote, to the challenges of bringing medical students in? Well, I can answer that question in one word, and it's called education. So truly, all of us in the medical staff, and maybe all that gravitate toward medicine, choose it because of its power to affect change. And I think for many of us to certain degrees in the medical staff, we chose medicine because we wanted to change the world. That's a lofty goal, but for many of us, if it's not lofty, it's probably not worth pursuing. So Nelson Mandela, I've always loved this quote of his and this thought. He said, education is not the most powerful, or is the most powerful weapon which you can use to change the world. So if we want to change the world, starting with Star Valley Health, then we all need to participate in education. And the medical students give us a portal and an avenue to do that. And it's been very well received overall. We've created a nightmare because now every medical student wants to come here from that school. And we've been contacted unofficially by another medical school that is yet to start, but may or may not be located in Provo and be associated with BYU. So to also participate with them because of some of the things they've heard. So I just wanted to shout out to, the staff, the medical staff in particular. The medical students' experience was phenomenal. So that's all I've got. So thank you.
Mr. Chair,
Yes, thanks.
I don't know if most people don't realize of the amount of time that Dr. Cowan spends in helping these medical students, and also the other physicians that are part of their rotation. This is a blessing and a curse for physicians. They feel obligated to give back because somebody blessed their lives when they were trying to learn medicine. But there is a tax to pay. And I just want the board and the community to know that our physicians are extraordinarily giving of their time. I mean, it on top of everything else that they have to do, they're doing this, and so it's you know, when you see our medical staff, and you know, just ask them, you know, how is, some of them aren't participating in the rotations yet, but many are, and just ask them and thank them for what they're doing, because they are making a tremendous positive impression on these younger physicians. And many young physicians, they either get encouraged to practice medicine based off of their experience through rotations, or they get extraordinarily discouraged. The rotations are not equally created. And there are some nightmarish stories that sometimes young doctors that are trying to go through training, they just don't have a good experience. And what Dr. Cowan's referring to is he's really giving them, Mark, maybe you can share with the board the preparation that you're giving them for the STEP exam.
Well, it's a team effort, and there's many physicians involved in this. It's a general surgery rotation first and foremost, but general surgery encompasses medicine, anesthesia, trauma, some components of ER, a little bit of OB. It's a little bit of everything as far as the shelf exam is concerned when medical students finish.
Oh, I'm sorry. It's not the STEP and the shelf. Yeah, thank you.
Yeah, the shelf exam. Each rotation, they take a test, and it's a challenging test. Internal medicine generally thought of as the most challenging. General surgery may be the next one, regardless. You know, the physicians that are participating, and they've been great. We've visited, we've got an outline, we've kind of got a thought process on how we want to prepare them for it, anticipate questions for them, review questions they've missed in question banks. And the first two that took it absolutely destroyed it. They did really well. So anyway, it's just it's a good thing. It's good to see education happening. Other staff from nursing to others are listening, some are taking notes, and we're specifically trying to provide that education, you know, in an open forum so others, you know, can listen. It's somewhat embarrassing at times maybe for the medical students because we put them on the spot a little bit, but others are benefiting from it, and that's truly one of the benefits and one of the things we're really trying to do. So anyway, not to belabor the point, but it's a good thing for us.
Thank you. Appreciate your efforts.
Thank you.
Mr. Chairman?
Yes. Please. Dr. Kirk.
Michael Kirk, CMO. So just from a historical standpoint, I know I'm always the one getting historical standpoints. Education to medical students has been an ongoing practice in this facility that's waxed and waned. I'm very appreciative of Dr. Cowan reinitiating the importance of medical education, medical student education in this facility. This is an apprentice type learning mechanism that medicine has always been. And one of the things that happens that isn't well understood is that it makes the educator a better physician. So much so that for some of our specialty colleges, they give us the allowance of, for example, in family medicine, 10 hours of CME per time spent. So indicating that it's important and it's useful for those that actually provide the education. One of the initiatives, strategic principles that Dan introduced early on after his arrival was having a pipeline of physicians coming to this facility. This is a way in which you make that happen. People come here, they like it, they understand that working in this environment is better than other environments in which they're exposed, and they're like, I want to practice here. So there's so many things that get accomplished with this, and it does take time, effort, energy on everybody's part, but it makes the entire facility better. Every person who's working with a patient, be it a CNA, an RN, what have you, is better because of education. And so the only thing we should do is figure out ways to do it better and more of it. So, thank you.
Thanks, Doc.
Thank you, Dr. Kirk.
Okay, well,
Abby Allman, Board Chair, Quality and Safety Oversight Committee. We had a great meeting. One of the top items was approval we gave for an award, I believe Sadie came up with, called the Good Catch Award. So in our facility, a big way to improve our processes is to not wait for something bad to happen, but to see in advance of it. And so, you know, sometimes there's a culture that you're tattletaling or people are hesitant to like speak up about things, but she's worked really hard to change that culture. And so similar to like the Star Award, where you're highlighting good things and then people want to duplicate good things, the Good Catch Award is designed and it got unanimous approval. I think everybody's really excited about highlighting the good things people are finding and being a little bit more vocal about it so that other people can see what catches were made and so that they're a little bit more aware of their surroundings and what they can do to improve the hospital before problems happen, which is exciting. As like always, all of the department chairs that reported are showing, you know, great numbers, great quality in the things that they're doing, always thinking outside the box, trying to like push the limits on, you know, what metrics are going to improve the hospital. I'm always really pleased to watch what they're doing with those. Did make a note, there was an outbreak of COVID in the care center, and so with some of the providers and some of the residents having to manage that, Dan, I'll have to take a moment and just show appreciation for them. And one big thing to note in Terry Lemon's report, we're going to be doing a big switch over like who stores our medical imaging and maybe who has the ability to read them, but it's going to be, we're going to be linked with a much like the powerhouse of radiology readers, right? Like a worldwide company.
Yeah, right.
You would know this. Yeah, I'll defer to people that know what they're talking about. Yes, that's the news that we got. Anyway, that will cause some hiccups, but we're kind of a small man. We don't know if we're going to be like first in line or if they're going to do some of the big ones and they'll have the kinks worked out when they get to us. But something to note that that's
So,
in the pipeline.
So are we still working with the, like Micah Beagle's team that they're?
Yeah, but their company's going with this bigger worldwide. But I think that it provides you with even more providers that we're working with. And so like any time of the day or night, you've got people in Australia that's like in the morning. I don't know. It sounds like a very positive thing. That's what I gathered from it. Everybody?
Yeah, Mr. Chair,
yes,
just one
please.
further update with that. So it is the PAC software program that they're updating. And the timeline that we were just notified is anticipating November, December timeline. That transition.
Perfect. Fourth quarter. It's not even busy during then.
Sure, yeah. Okay, one more thing to it.
Sure, yes.
One of the good things about it is that right now, when MIA is a group, and MIA sold or joined Radiology Partners, which is a huge group. One of the challenges, the way it is currently right now, is that the MIA providers read, they can read from our PACs. But what they can't see is that if a patient was at Ermac and Russell, not seeing necessarily all those things easily, now that they'll be looking at not just our picture archiving system, that's what PACS is, they'll be looking at the MIA or the Rad Partner picture archiving system. It's going to be much easier to compare results or tests from other places because they'll have it all under one big umbrella, as opposed to they look at ours but they have nothing to compare to. And a lot of times at radiology, it's really important to be able to compare to past images. So now they'll know there's a past image, which before they might not even know that it existed. That's one of the biggest pickups we're getting. Thank you.
So definitely an awesome thing that we're moving towards. One potential bad thing just to be aware of is that we've done a lot of work to like interface Epic with what we have going on or something. And so those nobody's really sure if that's going to be just seamless or if it's going to cause some issues. And so I'm anticipating it's going to cause some issues, but we're prepared for that. We know that that's a possibility. So always let you know potential problems.
You count on the left.
Or the end result of having a very good PAC system, so we're feeling positive about it. What one quality project Mallory England kind of was mentioned, I don't know if it was quality, but Mallory mentioned it, so I'll just end my notes with this. We are working harder towards getting the pre-authorization for surgeries like more streamlined, and they found a glitch where the benefits people were previously spending in the year weren't really populating, so when they were giving them estimates, it was just based on what we think we know about their insurance, but I found a way to merge all of that information so that we can get much more real-time accurate, and for everybody that matters. If they know that they met their deductible and we say you're gonna be coming with 16 grand or something, everybody's gonna be in an uproar, but the better we get at that system and looking at that is gonna be huge for our facility. So everybody's looking for great things to do and improve. I'm always so grateful when I go to quality meetings for the quality of care, the expectations that are here. And I think that they're always pushing envelopes, even though they're doing well on their metrics, they're always thinking, a step ahead, like what can they push themselves on? Great report from the sleep lab, they're hitting their metrics, and that all ties back to the financial end of things. If they're hitting the standards that they're having, it has an impact on not just quality. So that is my report. Any questions?
Any further questions? Sadie?
I would like to share some recent news that we had. So last week.
Do you mind stepping to the stand, I guess?
Yes.
We probably ought to have everybody do that so we can make sure that those that are listening in might be able to see and hear you.
So I'm Sadie, Vice President of Quality and Patient Safety. So last week, the state came to do our survey, which we have been expecting them for the past 6 years of our last survey. And we only had one deficient on the hospital side, emergency preparedness, no deficiencies, and then life safety, we had a couple of small things that we needed to fix. So we were really excited to have that good news. We've been waiting for this forever, and to have minimal deficiencies is awesome.
When will you have to anticipate the next one?
3 to 5 years. Yeah. Unless,
but you know that they like this, and so it's not as stressful maybe for the next follow-up?
Yeah, so they every 3 to 5 years, they're supposed to come in and do a survey of the whole facility. And then they can come on complaints. So in the past, we've had complaints that are filed, and they'll come and do a survey on those.
So how do we respond to the deficiencies? Is that a written report back to them, or?
Yeah, yep. So our team is working on that right now. We have 10 days from the time that we receive it, and we received the deficiencies yesterday. So we're working on it.
We'll probably pass that through the board so we can see what the response is.
Yeah,
great.
Yep.
Thank you, Greg.
Thanks, Sadie.
Any other questions or comments on quality? Mindy, ethics, compliance, and technology.
So Mindy Lyman, Chairman of the Ethics, Star Valley Board, Compliance, Ethics, and Technology. So we had a meeting, and there was one HIPAA violation that resulted in a termination. Trending access issues are employees accessing family members' records. So the employee that did that was terminated. Ladies team did found out what happened, and that person was let go. Staff are required to complete a conflict of interest form to help the compliance committee better understand where there are conflicts. The Board of Pharmacy completed a recent inspection with no deficiencies on that, so that's great. The IT team continues to improve and remediate concerns discovered on the most recent security risk assessment. LK, our Meditech and Allscripts archive has been made available in October. This is a long-term archive solution to bridge the gap in reviewing past information that was outside of the conversion into Epic, NetSuite, and Paylocity, and also meet the legal requirements for data retention. And then Chris Hinton brought to us an artificial intelligence policy that was reviewed and was approved by the committee at that meeting. And AI tools and Epic that are currently available and will be made available to us in December were presented. And that's all I have.
questions for Mindy? I had one time, so this HIPAA I guess it was violation. As I understand it, then those that are authorized to be into our software, which is Epic, the EHR, is that what it's called? They can't see everything, and they're not supposed to investigate certain family members' information. Is that the background of that? And so those that do are severely reprimanded. Okay.
And the medical record will like stamp which employee was in whose chart and if they had any reason to be in there, right?
Yeah, Mr. Chair, it obviously, everything comes down to patient privacy, especially in a small community. And so we take it very seriously. But we do want to make sure there's a just culture, meaning there's a balance between accountability based off of a person's intent and education. And in this particular case, once the glass was broken and we were notified that somebody had entered into a chart that maybe they shouldn't have, when we did the investigation, the person said, I knew what I was doing, I did it anyways, and it just signaled to us that there was a complete disregard to the policy. So we had really no other choice. We have to report these things to which
OCR.
Yeah, what does it stand for?
It's Office of Civil Rights.
Oh, it's the Office of Civil Rights. So we again, it's based off of sometimes people, they might click the wrong thing and they just said I had no clue, I'm sorry, I'll take more education. And so we have to deal with the facts and circumstances of each case, but I don't want you to think that we want people to feel safe as they're trying to navigate the record, but we want them to do it appropriately. And so we're having to give very regular reminders and education about what I just explained to you about balancing that accountability with education.
Okay, great.
Can I follow that?
Yes.
Does the report print if people are in like weird charts, or like, how does a case like that come up? Did a family member complain that they thought that they were being HIPAA violated, or is there like a system running thing that you're kind of looking for abnormal encounters?
Okay.
You know, work, Sadie.
So we work with a software called Protetis Blue Site, and it actually gets all of our information of chart access, plus our employees, their emergency contacts, the patient's emergency contacts, their addresses, and it looks at like when the last time the patient was in the office and what department the staff member works in, and then it gives us a suspicion score, and it will alert my team, and then we go in and investigate it further. So this most recent one came through the Protetis system as a suspicious activity, and this patient hadn't been seen in like 4 years. So that's why it gave a high suspicion score, and then we investigated it further.
All right, any other questions for Mindy? Looks like you were also the foundation.
Yes, so we did have a foundation meeting. That was on September 9th, Tuesday. The main things discussed were we had the Child Development Center, the LUCDA, came and discussed with the foundation possible collaboration type thing with some fundraising to have LUCDA and the hospital maybe get together, do some fundraising for a possible daycare, preschool type thing. They presented some information to us, the foundation there. And so we took that information, and I think there's going to be some more stuff down the road. Talked about that.
This was the school district?
No,
No.
LUCDA.
Who's LCUD?
So the Child Development Center, linking
Oh, Child Development.
you into
Okay.
child development. Yep.
Got it.
So they just said, our building is not big enough. We'd like to help people more. would you guys like to, anyway, so they came and presented their ideas to us and we discussed those, or the foundation did. Let's see, Mike talked to us about what's going on with the, kind of what we already talked about, the helipad and stuff. Auxiliaries had some things, good things going on that she updated the foundation. Jeremy Larson, who's in charge of the foundation, brought some ideas of maybe possible future fundraising. He wants to get more back to fundraising, back to basics. And so, capital fundraising, he wants to have, he called it feel good fundraising. And so he presented some ideas and wanted people to present more ideas of ways to, get some more fundraising going for the foundation. And he had some really good ideas on those, and so those were discussed.
Can you give a for example?
For example, I thought I wrote it down, just a second, let me see. It's been a while ago, so. They talked about a bowling tournament that they would do, maybe have the bowling and stuff, and do that. They talked about they used to have a night where they would have a foundation night where they would have a dance and dinner and stuff, and so they talked about that. He talked about just getting back to, saying we're grateful for everybody, we're thankful for your donations, and just kind of get community more involved in the foundation fundraising, so, yeah.
So agreeing that big donations really drive the situation, but to make a community presence.
Right.
Exactly.
And he talked about how, Alpine, we tried to push that big fundraising and it went okay, but it didn't bring in as much as we thought. And so he would like to get back to more basic fundraising ideas and back to simpler things. So, and then, bowling and movie, yeah, he put in the minutes, scholarships to high schoolers. And then he wondered about doing something quarterly as foundation activities. And so they talked about that too. And then the next meeting is November 11th in the Grays River Room. But this was a really good meeting and I enjoyed being there. The foundation does a lot and they really care about earning money to help the hospital. So I appreciate what they do.
Thanks for your report. Any questions? Who's attending in November?
It's me,
The Clint?
I think.
You check, Andrew? Just refresh a memory. It could be mine that needs to be refreshed, so.
Mr. Chair.
Mike, if you would.
Thank you. Maybe I could add just one item to board member Mindy's report. And that is the foundation board is interested in knowing what Star Valley Health would like them to focus on for fundraising. What capital item is there out there that they could focus on to help us to help the foundation fundraise? We want to coalesce not just general fundraising, and you don't fundraise to buy carpet or paint. You fundraise for something that is significant and meaningful to the community that they'll want to donate to and provide their funds, their philanthropy to. So they're asking for guidance from both administration and this board to identify an area that they could focus on fundraising for. So just wanted to share that with you. Thank you.
Okay. Cool. November. You out the hook, Clint?
I've got auxiliary in October and November, that's.
Okay, all right. Auxiliary report from Abby. Was there a meeting and did you attend?
Did I
Let's
go?
see.
Yeah, I think I did. I got in trouble. I was sitting over there. Yeah, I was talking too much with Sandy. What to say? Great bingo night. Such a party. I think I already did. Yeah. I think I reported on them already.
Don't they meet monthly?
Yeah, they do.
I don't think you.
But we're now like a day before the
Sure.
next meeting, so.
Oh, okay.
4 days.
Whoops.
Yeah.
So it's been a month since they met, basically. All right.
You probably did already look around.
I was definitely there. I came. Yeah, see, Star Valley Board Report, Abby thanked them for all that they do. Oh yeah, I gave him pins, I gave him goat pins, and I had to explain what goat means. Everybody knows what that means, right? Yeah. Greatest of all time.
You gave him goat pins.
Yeah, like, I was gonna have a competition because they were doing a fundraiser, and I'm like, whoever sells the most raffle tickets, I'm gonna get this great pin. And then I'm like, nobody was really keeping track, but they're all awesome, so I just got them all the pins, so. They were like, oh, that's so cute, what does that mean? So, that was funny. Yeah, still need a new fridge. That's funny, just the goodies we talked about in there. Was there anything important? They're just
I don't
cute.
think so. I think you
Yeah.
finished the major fundraising for the summer.
Yeah. Yeah, no, nothing to report, just that they're the cutest scouts. They're good for this hospital. Yeah. That is my report.
Okay. Anything else in the way of questions on subcommittees? Okay. You have in your packet the 2026 calendar of meetings. I'd note one change, Andrea, on the second line down. I think February the 25th is not a Saturday, at least on mine. It's a Wednesday. Does anybody have any concerns or problems?
Oh, that was,
Is
yeah,
it a strategic plan?
that was leftover from last year.
Just to
I'll
cut and
change
paste,
that.
I'm sure.
You're right.
Please reference the PR right here.
It
What's
should be a
that?
Wednesday.
Saturday, February 24th, and it should be midday.
I'm sure I would be here, but I doubt if anybody else would attend on Saturdays. Anyway, spring break is an adjustment, and also in November next year, Thanksgiving, we're meeting the week before. Any concerns, problems? I think you need a, what's that?
Not at this point.
Yeah, we can change them during the year. This is our,
Can we have a conversation about that? I mean, as long as we have a quorum, can we pretty much just stick to the schedule? Like, this one was a move one, but it's like, it seems like every time I kind of have to plan a year in advance, and not to be a brat, but
you plan a year in
I
advance?
really do.
Wow.
Like, it's in my phone, like, this is what I'm doing. I get the other things report, but I think that's why they have 7 people. It just,
It is fine, that as long as we have a quorum, we can conduct business, yes. If we
like,
don't
that
have
would be
a
the
quorum,
question, that we
so-
don't have to feel bad about missing occasionally, but it's harder to be like, right? The change is hard.
So I think as we have in the past, we'll just take it by case basis. If somebody has a concern or problem, then we talk about it. And we can decide not to change and yeah, we don't all have to be at every meeting.
Right.
Although, I
Is
think everybody takes
Wednesdays
it to
pretty
heart
good
and
for
wants to
everybody?
be there to be involved, so, when they can, so.
Yeah.
I think I'm looking for a motion. Is that correct, Andrew?
Yes. Thanks.
To approve our 2026 Star Valley Health Memorandum on meeting dates.
I'll second.
Jeff seconded, Abby moved. Any further discussion? All those in favor?
Aye.
Any opposed? Oh, we're 2 minutes behind schedule, Andrew. Resolution. Do we have somebody that wants to tell us what the background of this resolution for pharmacy director is?
You bet.
Brandon,
Brandon?
would you mind stepping to the pulpit
Sure.
or the stand or whatever you want to call that? Maybe it's not a pulpit. In this thing. Everything has a different word. Podium. All right, well, stand up one way or the other.
So, Brandon Taylor, counsel for the board in the hospital district. So, Pace Owens, who is the director of pharmacy services, and Dan and Tori as well, been involved in the conversation. Pace had been entering into some agreements on behalf of pharmacy that come up on a regular basis, and those, most of those are, hopefully all of them are listed in the resolution, and there were just some concern raised on whether or not he had the proper authority to be entering into those agreements. And so we discussed internally and decided that it made sense to adjust his job description to include those authorities, and then ultimately to have you as the board to authorize him to sign on behalf of the organization. Sounds like a number of these require some different account authorizations and access with governmental entities, that it would be extremely burdensome to have Dan or Tori or someone else do, that he's really the one that's reviewing those contracts with our review and assistance. And so really just kind of crossing the T's and dotting the I's here to make sure that he has the authority to enter into these agreements. You'll notice it also ratifies previous agreements that he has entered into to date. And then instructs the staff to update his job description to include these authorities as well. So that's really the background here. I don't know.
You don't see any problems with this, and you guys review every contract before he signs? Or
we review a lot of contracts. I don't know if it's everyone, but
we review the ones that are sent to us.
Yeah, sure. Yeah. And what kind of triggered our concern here is contract, or was a contract with the federal government that included a lot. It was a very one-sided contract and a lot of representations and certifications and penalties for non-compliance, and it got me thinking, hey, is everyone comfortable that the person signing, if that's going to be someone, has the authority to do this, and is he comfortable that he's got the support, and that everybody knows he has the authority to sign. So we just went through this process and determined that the best thing to do was amend the job description and prepare the resolution. And so that was very easy to do, and it's going to protect everyone, including the board and leadership and staff.
Okay, so just, I guess my follow-up question is, do we have other directors that, every once in a while we appoint somebody in administration to deal with certain particular thing, but do we have other directors that are doing something simpler, like in supply? I don't know.
The answer is not without my knowledge.
Okay.
Okay, so the organization knows clearly, the leadership at least from the department managers and directors, that signing authority is really authorized by the board to a few number of individuals in the organization, namely myself, Scott, Mike. And there are some occasions where we have to authorize somebody else to sign, just because of lack of availability. But in order to manage the contracts, to be aware of the issues, to make sure that there's a binding agreement in place, the organization knows that agreements have to go through a process, legal review, as well as an appropriate person to sign off on.
So we do have legal review on every contract. Great.
Yeah. So we're asking people to, and I don't know if we're overwhelming you.
No, not at all.
Okay. But that's really the process that we have educated the organization on. It used to be loosey-goosey. There's several reasons why you want to have a process like this in place.
Yeah.
And that's because we don't know what is out there. We don't know what to manage. We don't know what the termination language is, what's been agreed to. And it's not us just trying to, have OCD control over things. It's to ensure that we're protecting the organization, and that we're just aware of what the issues could be.
Great, glad there's a process and our attorneys look at all contracts.
Marlo, we probably review 30 to 40 contracts now compared to every one that we reviewed under prior administration.
Great. Yeah.
So this resolution grants the signing authority, but are there other control mechanisms in the hospital process? I'm thinking like spending authority that says once it reaches a certain level that it triggers some internal review.
Yeah, we got.
Yes.
Graham schedule. So the current process is the directors, unless superseded by the leadership team, have a 5,000 hour signing authority. It goes above that, it comes to my desk, and then if it's over 50,000, I give it a damn for authorization spending.
So then that's really the essence of the question, is just making sure that anyone who has signing authority isn't outstretching the commitment to the hospital. And it sounds like there's other control mechanisms in place to ensure that kind of additional review. Okay.
Thanks, Scott. Any other questions?
Mr. Chair, I just to clarify.
Yes.
So this new system we call use, it's the, any kind of invoice or contract comes in, that all catches that limit and forces it to be, if it's above that level, it would go to the, if it's not contract, it'll go to that, or the leadership team member over that director.
This is in our software, you're saying that it's kind of an automatic thing for notification, great.
Okay.
Then I think I'm looking for a motion to approve resolution 2025-10 or 2025-10.
All motion to approve that.
Jeff
resolution.
moves,
Second.
Cole seconds. We approve resolution 2025-10, authorizing the Director of Pharmacy Services to execute pharmacy-related contracts and agreements. Any discussion? All those in favor?
Aye.
Any opposed? Okay, move on to CEO report.
Thank you, Mr. Chair. I submitted my written report. I'll just cover some of the highlights. Cigna is back at the negotiation table after some pressures from several of the employers in the state and our conversations there. So when I have an official proposal in hand, I'll make the board aware. Wanted to make sure that the board knew that the next step with the big beautiful bill in the state of Wyoming, submitting their application to the federal government for the $100 million a year for the next 5 years for rural health transformation. That next step is October 8th. Dr. Kirk, Mike, myself will travel to Casper to represent Star Valley Health, and then other hospitals in the state will meet along with us with the state Department of Health, so that they can construct an application to submit to the federal government for those funds. And I think the deadline, Mike, remind me of the application, is November 15th.
Yes.
Yep. So November 15th, you got one shot at this. If the state messes it up and we get nothing, that's going to be unfortunate.
So it sounds like they've already started having some meetings. I mean, I was reading about the governor meeting with somebody up in the Worland area.
Yep,
I
Mike.
think, or a group.
Yeah, so what they've done is the director and the deputy director, they have set up meetings throughout the state. Mike attended one. When was it? Just
Last night.
It was last night down in Evanston. There were about 20 people from the public that gave input. So there's all sorts of ideas about, hey, we need to spend money here, we need to spend money, there, and I don't necessarily know how this is all going to go down, because there are a lot of different ideas about how to transform rural healthcare. I want to assure the board, and I think that you can see that Star Valley Health is leading out in providing access points to folks, the use of telehealth, the use of AI, the use of investing in service lines that are just essential in our minds for the success of a rural healthcare delivery system, namely EMS, our involvement with maternity services. We just received notification that Wheatland Hospital has now officially paused their OB program. That's a banner facility. And they showed a map of where the maternity deserts are in the state of Wyoming, and we would say easily half of the state of Wyoming just doesn't have access to OB services. So we feel like we have, without without any federal dollars, made significant investments into the right areas to get people access to the right care, and more is coming. So I'll talk about it in our report. It would be nice if we had a financial partner that would understand that, hey, we're leading out in this initiative of rural healthcare transformation, and to get a little bit of help to support our pathway of sustainability in this area. So any questions about rural healthcare transformation? Right.
Only got one, Tori.
May I add to that?
Yes.
Tori Probst. I'm putting on my care center administrator hat. Just so you all are aware, we also are meeting separately from these meetings being held as care center administrators with Director Johannesson about how that bill can help in long-term care.
Thank you, Tori. Really appreciate that. Thank you. We talked about the Alpine X-ray remodel. Great news with the Diamondville project as of Monday. Open, a lot of people come together in such a short amount of time. Want to publicly thank Mike Hunsaker's leadership in bringing everybody together to get this done, and again, in a short amount of time, namely IT, central supply, Jeremy's teams, who am I missing? Plant operations. IT. I did. I said IT. Yeah. And so Dr. Stuckey had a lineup of how many patients on Monday? 10.
10 patients.
10 patients on Monday. Brian McClure will be following up this coming month.
I believe he's going to go there on Friday this week.
Yeah. So Mike proffered the idea of having a little open house for the community, just people come in. So we're trying to put that on the table as well. But just great success with a short amount of time from when we received notification that we were going to get evicted by South Lincoln to maintain that presence. And we also want to just thank the board for your support in helping us to maintain that presence in that community. Okay.
We're going to be able to use that facility at capacity. Is that a once a month or once a week?
Great question. This is phase one. We're having
this fast on phase one. How's phase two come?
Phase two is being talked about. I'm sure that to clarify, you're probably looking at an urgent care, right? So we're already having discussions about when we could roll in additional services at the right time. But we don't have any specifics for you yet.
Great. I'm glad we're thinking about it though.
Mr. Chair?
Yes, Jeff.
I'm just going back to a comment Mike made earlier with the foundation. It feels like that if you don't have to respond to it now, but since you're looking for recommendations, if this is some new momentum happening in Diamondville with the opening of this and seeing patients, that might be an area to be looking for with specific opportunities for fundraising and projects that could be identified for fundraising in that particular area. Just as an idea that came from mind.
Thank you. Yeah. Talked about the Alpine helistop, the temporary helipad. Interesting statistic. We've had 11 air transports transferred from the Alpine ER since we've opened in January. So there's already been, helicopter activity. That's the number thus far, and it's going to continue to grow. Want to make sure the board has this on their radar as we're looking now that we've put we have some infrastructure in place at Star Valley Health to now add additional services without really significant increase in the cost structure, so we can take advantage of incremental revenue. Here, I've listed off a couple of these. We anticipate adding new providers and/or incremental revenue in the following existing service lines over the next 9 months. So during this fiscal year, we're going to add procedures with interventional cardiology, orthopedics, specifically foot and ankle, ENT, rheumatology, which just kicked off, and primary care and urgent care, which we're hopeful, Diamondville would be, an example of that.
We anticipate adding new providers and incremental revenue in the following new service lines within the next 12 months. We're looking at interventional radiology, neurology, nocturnal hospitalists, and pulmonology. And then as a teaser, the team knows that I'm talking also about nephrology and dialysis as a phased approach over the next several years. So not going to put it on the list right now, but again, I want the board to know that these are the services that we're looking to, again, provide access points for our community. Yes.
And traditionally, is dialysis a lost leader for hospitals? Is that why you don't see it everywhere?
Yeah, it really comes down to a volume, and it comes down to a sustainability issue. It's something that is badly needed. There isn't dialysis in Western Wyoming. The closest is Montpelier, and then Idaho Falls. And I would love to I've already reached out to St. John's just to broach the subject of partnering. We're still trying to figure out what exactly the right approach is to bring nephrology services to the area. But as the area grows, and nephrology and cardiology go hand in hand, and I'll defer to our physicians to explain the clinical symbiotic relationship there, but just know that as we add services, again, I refer to it as a symbiotic relationship. You need the support from multiple areas to really keep care close to home to take care of folks. And so we want to start to layer in all of these additional services to the existing infrastructure that we've already invested in. Okay.
So nocturnal hospitalists, those that work at night or what?
Yes.
We don't have those?
What will happen is we do have hospitalists. We have 2.
Yeah.
And the problem is during the nighttime, you need somebody to admit patients into the hospital, and to create a sustainable model for your hospitalist program. You need more than 2, but we don't have the volume from an inpatient standpoint to hire multiple people to live here just to cover hospitalists. So we are contracting with Intermountain Healthcare to provide that service remotely, and they can review the patient. They can also have admitting privileges so that when the hospitalist comes in on the day, they can do a handoff to that hospital to manage the patient appropriately. So it's more of a sustainability initiative than anything else. Okay.
Your hospitalists stay on like 24-hour shifts, 7 days a week, but you try not to bug them during the sleeping hours?
Yeah, so it's a touch and go relationship. They're at home if we need to call them, but people are very sensitive to making those phone calls just so that we can preserve people from burnout.
Yeah.
All right, we touched on many of these highlights during the Finance Committee. I will just maybe add a little bit of color to the operational excellence with the cash position. Again, the entire revenue cycle team needs to be commended for their focused efforts over the last 6 months. 85 days in AR down to 57 as of today. We're breaking records with cash collections. We do have a plan for the organization to hit 80 days cash on hand and to meet our covenant by the end of June, so that we're in compliance there. Through the first 2 months, and September is looking very robust as well. Our operational earnings have exceeded our budget by over $1 million. We have a healthy 10% margin thus far this year. So for the first quarter of this fiscal year,
we feel very good about where the organization is. Now, as you're all aware, we are still concerned about self-pay and the burden, the financial burden that's placed on patients, and how we're the bad guy and having to try to collect that. So bad debt is on our radar, and the percentage of net revenue is on our radar. And that revenue on the income statement has to translate into cash. So that's really the balancing act, as we can do all this work, great work, right? But if we don't have the cash to pay the bills and sustain it, then we're in a similar position we were 6 months ago, saying, hold on, what are we doing here? How are we going to support EMS? How are we going to support these other initiatives to deliver rural health care, which we know are the right moves, but how do we pay for it? So that's what our focus is on, is having a healthy margin, having good cash collections, so that the services that we're currently providing and we're going to invest in are sustainable. IT risk mitigation this month. We're going to have our first cybersecurity tabletop exercise. We're having an expert fly in, and they're going to run us through the gauntlet, and we're going to assess what our readiness is and how we would handle being held hostage, and if we have to shut down our patient records, if we have to ship patients, how do we communicate this? What's the legal ramifications of a cybersecurity attack? So we're going to run the organization through that exercise so that we're more prepared. The hospital survey, Sadie mentioned to you that the organization passed with flying colors. We'll get you, the board members, a detailed list of the deficiencies and our action plan to resolve those deficiencies in the time allotted by the state and the federal government. But we don't feel in any way that our deemed status with CMS is in jeopardy. Now, with that being said, the federal government can follow up on their own with their own survey from the state. It's basically the federal government saying, thanks state, but we want to check whether or not you're doing a good job of surveying your facility. So just FYI, we do anticipate our annual survey in the care center here very shortly. We're coming up against that window, correct, Tori?
Right, after next week, they'll be passed.
Yep, they'll be passed after next week. So more to come on that. Market increases have been implemented. Merit increases have been paid out to all frontline staff, directors, and managers. As we've communicated with you before, they're going to be compensated for their merit increases at the end of this month. And then retirement amounts that we held on to, those beginning of the pay period last Friday, every single pay period, those will be restored until the end of this calendar year, so that we can meet our commitment to the good folks that work with us. And then lastly, I want the board to know that the decision has been made to maintain the existing staffing level at the Thane EMS station that we've had over the summertime. Here are the two drivers. We've looked at the numbers. And when we assess now the number of interfacility transfers from Alpine to Afton, and then if there's any other interfacility transfers from either Alpine or Afton to an out-of-state facility, it's going to cost more, but it's the wise thing to do considering the increase in the number of emergency room visits.
Thank you.
Okay? And that is my report, Mr. Chair.
Any questions?
Yeah.
Or comments?
There's
Yes.
a helicopter landing up on right now. If it doesn't have that, what's that?
What's that look like?
Tori, you want to answer that one?
So currently it's different with every case, so we've landed on the road. But when we do that, we need to get law enforcement involved, so they have to be available to shut down the road. We've landed in the parking lot, again, utilizing resources to help clear the space in the parking lot. And we have used the air park, again, utilizing resources to take the patient from the Alpine Clinic.
That was the original plan for the airport, right?
Those are the three methods that we're.
Follow-up questions or anything?
That just, it sounds really
Sounds what?
horrible.
Horrible?
To have to make that primary time something.
Been
It
horrible
is.
11
That's, I
times.
see the benefit happen. I was just got 11 of them since June. Having to clear that parking longer.
Yeah.
Roll ones and ask everybody.
Any other follow-up comments? Under FYI, remember the employee holiday breakfast on December the 2nd? If you'd like to participate, I think Andrew would love to know. And with that, I think we're ready to move into executive session. Does anybody have any other questions? So I need a motion for executive session. Mindy moves, Abby seconds. We take a 5-minute break and go into executive session when we come back.
Sounds great.
Who's up?